show. We welcome now Representative Missy McGee. She represents District 102. That includes Forest and Lamar counties. Serves as the chair of the House Medicaid Committee. Representative McGee, good to see you. Thanks for coming on.
Hi, Gerard. Greetings from the Hub City. I appreciate you inviting me on today.
Absolutely. Thank you. So we thought we might be back down there at the Capitol again today, given some of the vetoes that occurred by the governor yesterday. But I spoke to a couple of members last night after the deadline for that, and they said, no, it doesn't look like that's going to happen. So I think we're done. We're done, and done. Instead of dead, we're done here. An active session it was. Well, first talk about the possibility that you guys may convene again today. Through a procedural move, you reserved a day. Is that correct? An additional day for the possibility of returning to consider overriding any vetoes that the governor may have applied to some legislation sent to his desk. But that didn't happen. The decision, I guess, was made not to do that.
That's right. So we got the word last night. There were a few vetoes or partial vetoes that came in late yesterday afternoon, but nothing that we felt like we needed to bring everybody back to the Capitol today. So I do believe, as you said, we are done for the 2024 legislative session. And look, it was a 4-month session. And so I think everybody's happy to be back at home right now for a little bit. So,
yeah. Well, the first session of a new term, of course, always some 30 days longer than the subsequent 3 terms. And it was and maybe the most active session in terms of just the number of high-profile measures, some of which were somewhat controversial and contentious even, certainly between the two houses, than I can remember. At the end of the day, it doesn't feel like a great deal. I don't want to rain on the parade here because I know a lot of people exerted a whole bunch of effort, including you, with the Medicaid situation. But at the end of the day, it doesn't feel like we can point to a lot that got finally enacted.
Well, I think that we did get a lot done. You know, some things we have to think back all the way to the beginning of February that we got done. For example, maybe not the highest issue or the issue with the most attention, but like in the Committee on Medicaid, we got presumptive eligibility done for pregnant women on Medicaid. That was a big issue. It got a little bit overshadowed because we took on even bigger issues in the committee. But the House brought that up in early February. We passed it, sent it to the Senate. They passed it and sent it to the governor. It got signed. You know, we certainly can't ignore the fact that we got a huge education bill passed and really historic legislation for you know, the children of Mississippi, and I'm grateful that we were able to get that across the finish line. And there are plenty of other things. You know, look, Gerard, when I come home after any session, I always have to reflect for a week or two about the things that we got done and even more about the things that we did not get done. And those things kind of hang on me for a little while. But, you know, legislation is hard to get passed. It should be. That doesn't mean that we like it that way, but sometimes it takes a few years to get things across the finish line. And the more difficult the subject matter, you know, obviously the harder it is. But we worked really hard this year, and I think we moved the needle on plenty of things.
And fair enough. And I certainly didn't want to appear to imply that a lot of work wasn't happening, because I witnessed it firsthand. I know, including yourself. And you're so right. It's making legislation, making laws, it's hard. You got a bunch of people that have to agree on stuff, and that's the way it should be. It should be a high hurdle, a high bar, and that's I think the miracle and the redeeming factor of a Republican form of government. We elect you people to make the laws for us, and you represent your constituents as you see fit, and I appreciate that and respect that. The education formula, Representative McGee, that's a major deal. I was honestly a bit pleasantly surprised that we were ultimately able to get that over the finish line. It didn't feel like it. It was tenuous at best when it was being deliberated. But here we are after, 27 years or so. We got a brand new way of funding K through 12 education, which consumes slightly more than half of our general fund budget.
That's right. It was huge. I'm very grateful to Speaker Jason White for making that a priority. My friends, Chairman of Education Rob Robertson, and my good friends Kent McCarty and Jansen Owen did a really fantastic job representing the House position on that. And there were some ups and downs. And while I was busy working on Medicaid, those guys were up to their ears working on education, and we got it done. And I think there were moments that we didn't know that if that would happen, but we were able to find a compromise ground with the Senate, and we got it done. And I think that I think that was a huge win for us. So.
Yeah, no doubt, and lots of reports have been written about that. It also appears that not only did we overhaul the formula, but a couple $100 million more will be appropriated as a result to education.
That's right. More than we've ever spent before on education in Mississippi. So that's a win. That's a win for our school children across the state. And we feel like it's a very equitable, fair manner of getting funding to the schools. And they know what they're getting now. They should know exactly where their money is coming from and what that is, where they weren't all that sure before, because nobody could really point to specifics in the old formula. So we're pleased with that and feel like we'll see a lot of good things from it coming forward.
You mean they don't need an economist or a mathematician to help them figure out how much money they're going to get under the old formula?
Look, our superintendents and those that are running our school districts have plenty on their plate. So I would hope that they would not have to also wear that hat. So I think everybody's going to be really pleased with this.
Yeah, I do too. Something that comes up a lot, certainly here on our text line, and just anecdotally out in public, is the ballot initiative process, which Rhino and I were talking about it earlier, has been deemed invalid by our Supreme Court going back to 2021. So here we are 3 years later, and we've had attempts in each of the subsequent sessions to restore that. Can't seem to get that over the finish line. What do you think is going to have to happen to finally return such a mechanism to the people there?
Gerard, the House has been supportive of that and has sent legislation to the Senate on to restore the ballot initiative. I certainly am very supportive of that. And you and I have talked about this, I think, almost every show I've been on with you. So I'm sad that we could not get that done. I think the people of Mississippi very much want that. And yet we have not been able to get to a place of agreement with the Senate on that. And so we keep losing that, but I'm hoping that we'll circle back up next year and give it a try. To answer your question, I don't know what it will take to get both of us on the same page and be able to actually pass a bill and send it to the governor. But it is very important, and I think we have said that we were going to do this for several years now, since it was invalidated by the Supreme Court several years back, and here we are, and it'll be 2025 at the earliest now. And so it's time, and I'm hoping that we will really put all the effort and bright minds on that to get us where we need to be on that, because I certainly support that.
Something else that failed was mobile sports betting. I was in the gallery when Representative Uri presented that legislation, and I felt like he did a great job. I thought it was a well-designed bill, but just couldn't seem to get it across the finish line in the Senate.
Yeah, I'm disappointed. Casey's my desk mate. He sits right to the left of me, and so I know he worked really hard on that. We took that up pretty early in the session as well, and in the final days, we could not get an agreement on that as well. I'm certain that issue will continue to come up, and again, I'm hopeful that I think Mississippians want that option. I think money's going out of the state on that and with regard to that issue. So I'm hoping that we will be able to pick that back up and find a compromise and move forward with that.
Yeah, I agree. Can you hang around, Representative McGee?
Of course.
Okay, good, because we'll dig into the SAFER Act, which the governor signed yesterday. I think we have to point to that as a major accomplishment in our state as well. And then we'll get to Medicaid, you serving as the Medicaid chairperson. When we return after these messages, we got Representative Missy McGee, represents District 102 on middays. Stay well, studio. Representative Missy McGee is our guest. She represents District 102. That includes Forest and Lamar County, serves as the chair of the House Medicaid Committee. So the governor signs the SAFER Act into law yesterday, and that, too, was a bit touch and go there for a while. It seemed like Representative McGee had to come down to the wire to finally get that legislation across the finish line. I guess the first comment I would make is that it's kind of sad to think that we even have to pass such laws, honestly, where we have to define what a man and a woman are, and then write into legislation some protections for these spaces that are designated as same-sex spaces in these various public venues. But here we are.
True. Well, yes, like you said, the governor signed that into law yesterday. I will say, yes, that bill got a little bumpy as we went through the process. We ended up having to pass a suspension resolution to bring that bill back up. I will say, I just mentioned my desk mate, Casey Ure, who sits on my left. Well, my other desk mate is Chairman Joey Hood of the Judd A Committee. And yep. I know that Joey worked really hard on this issue. He did a great job. There was some misinformation that was traveling around the state, but that's just the world that we live in. But in the end, we passed that. While that was all happening, I was busy trying to salvage what we possibly could on our Medicaid expansion bill. And so Joey was working fiercely on that, and I'm sitting right next to him working on Medicaid. But yes, we got that done. The governor signed that into law yesterday, and I know that was a bill that had a lot of interest in the state, and so that was one that we did get across the finish line this year.
Before we dig into Medicaid, anything else, Representative McGee, that you wanted to highlight that you felt like were be considered accomplishments in just good legislation?
What I really want to say is that I think we had a really monumental year under new leadership. I cannot thank our new speaker, Jason White, enough for his leadership and his willingness to tackle issues really that have not been necessarily tackled before, and Medicaid is certainly one of those. We have never even had a hearing before on dealing with Medicaid expansion, and the Affordable Care Act has been around for 10 years or more now. So it was his first year as speaker, and he jumped right in with both feet and took on some really big issues. And so, like I said, I think at the beginning of last segment, I'm proud of what we were able to do, and kind of we know where we are now and where we'll pick up in year 2 of this term.
So, serving as the chair of the Medicaid committee, you championed legislation that would fully expand Medicaid in the state of Mississippi, with some exceptions to just the standard expansion that would require approval of waivers, issuance of waivers by federal CMS that primarily centered around a work requirement and just some other qualifications that if you were enrolled in commercial coverage, you'd have to sit out for a year before you could enroll in Medicaid if you were qualified for it. I think those are probably the main nuances that CMS would have to approve in a waiver, unless there's something else you can think about. But that comes to mind as the primary exceptions. The Senate had a different idea about what perhaps some form of Medicaid expansion would look like, and at the end of the day, you guys were just unable to reach a consensus on measures that, or a measure that would pass both houses and be sent to the governor.
You're right, and we worked very hard on this issue. We passed House Bill 1725, which the Speaker is the lead author on, in February. I still believe that it was a very good bill. there's no such thing as a perfect bill, but I think we proposed a great bill that would have provided health insurance for our low-income Mississippians. There was two sections, and actually, I was on your show maybe a week after we passed that, and you and I have talked about this extensively, both on the air and just in the Capitol when I run into you. But the majority of our members did believe that there should be a work requirement, and so the 1115 waiver, which is basically like a demonstration project, if you will, for the federal government, is we said it directed the Division of Medicaid to send an 1115 waiver up to CMS for approval. Several factors were in there, but one, it expanded Medicaid to individuals up to 138% of the federal poverty level, because that is what is required to draw down the maximum federal match, the 90% match. So the government pays, the feds pay 90%, the state has to pay 10%. There's also an incentive for non-expansion states, which there's only 10 of us left, that would have given us an additional 5% on our traditional match on our traditional our Medicaid program. That would have been about $700 million over the next 2 years. So significant dollars. We felt like that was financially a very sound and wise thing to do. Plus, we know that we are the most unhealthy state in the nation, have the shortest life expectancy of any state in our nation. And so it was a priority for the speaker, and it was a priority for the House Medicaid Committee. And so we passed House Bill 1725. It did have a work requirement in it, but it said that if the work requirement was not approved by CMS, that we would still move forward with the state plan amendment, and we would charge the Medicare organizations with doing workforce training, financial literacy, things such as that, to kind of fill that gap, because, as you well know, that CMS has not approved a work requirement during the Biden administration. And there were folks that thought maybe we could be the one exception. You and I have even discussed that. That really could not be your plan, though. Not one state has a work requirement that is a full expansion state. And so we were going to ask for the work requirement, but if it was not approved, we still had language in our bill that would move forward with providing insurance for our low-income Mississippians. We sent that over to the Senate. They also had a bill. But it really just it was just code sections, which basically is not really, well, it didn't have any language or a plan for expansion. It just had the code sections in there so that they could later amend that bill. Their bill, they let die on deadline day, took up our bill with a strike all amendment and put their language in it, which is very customary. But their plan only expanded to 99% of the federal poverty level. So that is not, that does not get the 90% match. And it had a very strict work requirement in it with working 30 hours a week. So that was the bill they passed. So, but we still had a vehicle alive. We went to conference, and the hard line for us was getting the maximum federal dollars and ensuring the most Mississippians that we could. And so we went to conference, and we proposed, there had been some concern about the folks that are 100 to 138% that were on the federal exchange. There was concern about destroying the exchange in Mississippi. And so our compromise position to get the Senate to move from 99 to 138 to draw down that 90% match was to keep the 100 to 138% of the federal poverty level, those individuals that fall into that category, keep them on the exchange, pay the deductibles and copays, which would be required by CMS to get the 90% match. The 0 to 100% of federal poverty would stay, their delivery would still be through the MCOs, just like our traditional Medicaid program. I did not realize, honestly, that it was going to be so hard to get them to 138%. I really thought that our big disagreement would be how we were going to address the work requirement. But they did move to 138% of federal poverty level, and brought us a conference report that said such. Did not come off the hard work requirement. We in turn countered with that and proposed something very similar to what North Carolina just did, that said, basically it included trigger language, a law that included trigger language that said, if we are not approved for a work requirement, then that language would still be in law. And as soon as the federal government started approving work requirements, whether the CMS started approving them because of a new administration or because the law changed or because of the courts, anything, that we would immediately apply for that work requirement. That proposal was not met favorably by the Senate, and they would not sign on to that. So in the final hours, and you know very well, Gerard, we live and die by the deadlines. We were down to the wire. It was the conference report had to be filed on a Monday night at 8 o'clock, and we were disappointed that we could not get the Senate off of that strict work requirement. But we did sign a conference report that did go to 138%, but did have a work requirement. But there's more to the story. So that's just the beginning of it.
Yep.
So.
Well,
happy to continue talking about that.
All right. Well, let's stick around. We got a break right now. We can continue this discussion on the other side of it. We got Representative Missy McGee visiting with Representative Missy McGee. So, Representative McGee, before we went to break, you were providing an excellent, I don't want to call it a summary, it was really a chronology of all the events surrounding this debate over expanding Medicaid in the state of Mississippi. You know, before I let you keep on with that, just something I've always wondered is, and thought was really I don't want to say bad terminology, but maybe terminology that mischaracterizes, and that is Medicaid expansion. I've encountered a lot of people who really believe that the group that would be covered under so-called expansion are already eligible for Medicaid. I don't know if you've heard that from your constituents or not, but that's widely believed. And what they think expansion means is like more benefits, that there's somehow more money being floated around or being distributed, or just growing the program that way. And so I've always felt like that just the descriptive term Medicaid expansion is really I don't want to say disingenuous, but not a reflection of what it is. And that's not a statement for it or against it. It's just an assessment just based on the typical reaction I see and hear from people is, you mean those people aren't eligible now, the people that would be covered if you expand it? And the answer is no, it only covers pregnant women, disabled.
That's right.
Blind children, which, by the way, comprise, as you know, the vast majority of those covered by the Medicaid program.
Over 50%. No, you're exactly right, Gerard. And that was part of the education process, even among legislators, to have them fully understand the eligibility categories. There is no eligibility category for a 19 to 64-year-old that is not disabled or does not have children. There is a category for a dependent caregiver that makes that a very, very, very low income.
About $4,000 a year, by the way. About $4,000 a year. Yeah.
Very low income, and it only comprises about 7% of the Medicaid population. Anyway,
yeah,
those currently on Medicaid in Mississippi, 53, 54, 55% are children, first of all. So the vast majority of our Medicaid population are children. And then the others are those that are disabled, elderly, or pregnant. And then also that smaller category of a parent or caregiver of a dependent child that is extremely low income. So those are the only eligibility categories. So an able-bodied, 19 to 64-year-old that is, like I said, not disabled and does not have children, there is no eligibility category for that person who is working every day, perhaps in a job that doesn't have insurance, and they're not covered. And so, and again, we've already talked about on the broadcast that we are the sickest state in the country, the shortest life expectancy, highest infant mortality rate, highest prevented death, all these sorts of things. So we want to move off those numbers. And so that is why it has been such a priority for the House this year, is to provide this health coverage. It's not mailbox money. It's not, a check in the mail. It goes to a provider exactly like the insurance that you and I may be on. It functions in much the same way. You go to a doctor and you have a card, and you are paid for that medical service. So So anyway, we back to the chronology, and it's very hard. It's a complicated, long process, and it's hard to even discuss in a short snippet. But we did sign a conference report that did expand to 138% of the federal poverty level, which that's about $21,000 a year.
Right.
The bill still had a strict work requirement in it. We could not get the Senate to look at any other way, even with trigger language that once work requirements might be approved or allow for workforce training through managed care organizations. When we wanted to be really flexible to encourage work without putting that strict work requirement, simply because we knew that during the Biden administration, that no work requirements were being approved. And so we were trying to get the health care to the people, and believe that if we sent something up to the feds with a strict work requirement, it would be struck down, it would be over, and we would be right back to starting over from scratch. So we agreed, we kicked a field goal. That's sort of how I felt about it. It was not a touchdown, but we felt like we were going to put some points on the board. Had a conference report, felt like at least we would have the things in the law that we knew we agreed on. Getting it up to 138% of the federal poverty level. We had an assessment on the managed care organizations to pay the state share. That would already be addressed. All sorts of things. The work requirement would be, the issue. And we were willing to let Division of Medicaid apply for an 1115 waiver with the work requirement. Let's see what happens. If it's approved, great. We would move forward with the program. But if not, we were at a minimum, we wanted to apply every year until we got it approved. If, for example, Trump is elected in November, there's a change in administration, we wanted the law to already be there that said the Division of Medicaid will apply every year until we get the job done. Truthfully, though, if we sent the work requirement up, it was denied, then there was also an opportunity for us to step back as a legislature and say, okay, it was not approved. We tried it. We showed the people of Mississippi that the intent is to be for working Mississippians. But we know that there are areas that that we could not get that approved. So we decided to move forward with that, and then we could work on that in the next legislative session. And very key, Gerard, too, with regard to the work requirement, if it was denied, we could come back and address that in subsequent legislation, which didn't require a 3/5 vote either. So it would be a lower bar, because of the assessment on the managed care organizations. Our bill was a 3/5 vote, so it was a very high bar. So we signed the conference report, and then and a couple of days before, when we were still in negotiations, Democratic House Leader Robert Johnson was very much a part of the conversation. He and I talked all day, every day. I was in his office. He was in my office. We talked after hours. We talked while we were at home. Before the conference report was signed, a few days before, he said, "Get the best deal you can, and we will support you." He said, "We will get the best deal you can." And we worked through the weekend to try to get the Senate to be more flexible on the work requirement. We could not get the Senate to move off of that. We filed the conference report and fully believe that we had the votes in the House. And then only to find out the next day after the conference report was filed that the Democrats were not going to support the bill. So that was surprising to us, because we had been told that they would support the best deal that we could get. And so, that's 41 votes that we needed. There was also talk about whether the Senate actually had the votes to pass it anyway. So some said they did, some said they did not. We'll never know at this point. But so we lost those votes, and so now, as a result, we don't have a bill. We don't have a law to come back and continue to work on. And I think it'll be harder. I think it'll be harder in the future. But the Speaker has certainly indicated it is a priority for him, and I certainly believe in Medicaid expansion as chairman of the Medicaid committee. But I wish that we had gotten something done that we could build on, rather than having to start from scratch next year. So that was hugely disappointing.
Do you anticipate that there will be some additional action just between sessions, perhaps some meetings, hearings, information gathering?
I would certainly, yes, I do. I think that we will continue to find a way for us to come together and be able to advance legislation that both the House and Senate can support. But I mean, right now, as it stands, the Senate has said that can only support a strict work requirement, and then we have a large chunk of our body that says that they will not. And so I would hope that we could all come together and find a compromise position to get this very big historic piece of legislation down the road. So, because the ultimate goal is providing health care for our low-income Mississippians. That is the ultimate goal. So I'm hoping that we will find a way to do that.
Yeah, well, we got to go, but just something in parting, I would point out that the work requirement is something that I know is essential to everyone involved in this on both sides, including the lieutenant governor. The governor said he's vetoing anything he can related to this with or without a work requirement. I just wonder if we've really researched this work requirement issue sufficiently, and I can talk to you about that later on. We got to go now, but I'm not convinced that Medicaid is a carrot that's going to get people to go to work.
No.
Just a thought. Yeah.
No, but that's not the goal of Medicaid. The goal of Medicaid is to provide health insurance.
I think there's some people under that dome that believe this is a way to improve our labor force participation rate, though. I'll just put it that way.
I'm happy to have that conversation. I have thoughts on that too, Gerard.
Okay.
So,
see you.
Thank you. Thanks for having me.